Hello, my name is Prabjot Kaur and I'll be your nurse today. May I have your name and date of birth, please?
My name is Hira Singh. My date of birth 6/6/1970.
Okay,
Yeah.
and I'm gonna check your armband. Looks good. I will be giving you oral medication today, your medicine for pain, and I will be administering eye medication. I will be administering ear medication, your nasal spray, your inhaler nebulizer, and changing your transdermal patch and giving you rectal suppository. Okay.
Yes.
I made sure I performed excuse me, hand hygiene. I provide the privacy. I made sure I explained the procedure. I did my 6 rights of medication, which is right medication, right route, right patient, right medication, right route, right time, right dosage, and right documentation. I also check the lab values and check the vitals, which are in normal range. Do you have any allergies?
No.
Okay. And I also explain the medications, what they are for and what their potential side effects can be. So I'm gonna start off with your oral medication. I will bring it right now. So I bring the pain medication for you. I made sure I did the 3 mark check, which is when retrieving the medication, I made sure it's the right medicine while preparing the medication and before giving it to the patient. Before giving the medication to the patient, I made sure the patient is not NPO. The patient is alert and oriented, and patient can swallow the medication. So if there is any case the patient cannot swallow the medication, needs a crushed medication, we would make sure the medication is not coated, the medication is not extended release, and it is crushable. So as per the patient preference, if there is a need to give crushed medication, the patient would like to take it with the applesauce. So I would mix the crushed medication with the applesauce and give it 1 spoon, or as patient prefers. So here is the medication. Would you like to take it one at a time or all at once?
1 tablet, please.
Okay. So here is the medication, and you would take it. And when the patient was administering the medication, the patient was able to swallow all the tablets well. There was no problem at all. The patient took it with a full glass of water. So next I will be administering the eye drops to you. Okay, so next I'm gonna do the eye drops. I make sure that I do the 3 MAR checks, which is when retrieving the medication, while preparing the medication, and before giving it to the patient. I make sure the eyes, there is no eye problem or any eye condition internally or externally. The eyes visibly are looking okay to put the medication in. So I will take the tissue and gonna ask the patient to tilt their head little back and look up, and I'm gonna make sure that there is no contact between the dropper and the eye. The dropper is not touching the eye, and I'm gonna put the medication in the conjunctival sac. And after applying the medication, I'm gonna apply the pressure to lacrimal duct for a few seconds, and then same to the other side. And you're all done with the eye drops. The next I'm gonna do the ointment. Again, I'm gonna do the 3 MAR checks when retrieving the medication from the pyxis, while preparing the medication for the patient, and before giving it to the patient. And again, I'm gonna check if there is any eye condition to the patient, and I'm gonna ask to tilt their head back again, and then apply the ointment to the conjunctival sac from the inner to the outer canthus. And then I'm gonna ask you to close your eyes and then roll your eyes in a circular motion so the medication can go to all the places. And then that is it. And I have applied the ointment for the eyes. The next I'm gonna do is the eardrops. Okay. The next I'm gonna do the eardrops. I'm gonna make sure that the ears are clear, that there is no ear damage or any condition going on. And I'm gonna ask, before doing the medication, I'm gonna do the 3 MAR checks, which is when retrieving the medication from the pyxis, while preparing the medication, and before giving it to the patient. And I'm gonna make sure that I roll the bottle and bring it to the body, the patient's body's temperature. And I'm gonna ask the patient to tilt their head a little to the other side, to the opposite side. And for adults, we put the medication, so we pull the ear upward and backward and put the medication, and we make sure that we are applying pressure to the tragus after inserting the medication. So make sure the medication goes into the ear canal, and same to the other side. And we ask them to stay in that position for a few minutes so the medication can go directly into the ear canal. And I'm all done with this medication. Okay, so next I'm gonna do the transdermal patch. I'm gonna make sure that you do not have any previous one on. So I see that you have the previous one on, and I'm gonna remove that and throw it away. So before applying a new one, I'm gonna perform hand hygiene, put on gloves, and then get the medication patch. I'm gonna make sure the 3 MAR checks, which is again when retrieving the medication, when preparing the medicine, and before giving it to the patient. So I made sure I have my gloves on, and I'm gonna see the skin. I wanna make sure before I put the medicine in that the skin is intact, the skin is clear, and the skin does not have any hairs on where the medication goes in. So I will apply a new medication patch on, and I want to make sure that I put the time, date, and put my initials on. And this is all for the transdermal patch. Okay, so the next I'm gonna do your nasal spray. I'm gonna make sure and assess your nares for any obstruction. So I'm gonna ask the patient to blow their nose for so the nares can be clear. So I assess them, they're clear, and I can apply the medications. Again, I'm gonna do the 3 MAR checks, which is when we retrieve the medication from the pyxis, while we prepare the medicine, and before we give it to the patient. So I'm gonna ask the patient to tilt their head forward, and I'm gonna do one spray onto each one. and then I'm gonna give the tissue to the patient just in case any medication comes out of the nose, and I'm gonna ask them to not to blow their nose for a few minutes so the medication work well. And I am all done with the nasal spray. Okay, so next I'm gonna do the inhaler and nebulizer. So before I give you, I'm gonna check if you have any symptoms. Excuse me. So before I give it to you, I'm gonna shake the medication well. Of course, do my 3-MAR check, which is when we retrieve the medication from the pyxis, while we prepare it and before we give it to the patient. I'm gonna make sure the medication, when you put the inhaler in the mouth, it is locked around the mouth, so the medication does not come out. I'm gonna ask you to inhale deeply and slowly when I press the medication, and you hold your breath for 10 seconds and then exhale slowly. And I'm gonna press the medicine, and that's it. And same for the okay. So the next I'm gonna do is nebulizer. So again, I'm gonna check the medication, do my 3-MAR checks, which is while we retrieve the medication from the pyxis, while we prepare the medicine, and before we give it to the patient. I'm gonna put the medication into the mouthpiece, and the patient would assist, or they can put it around their mouth. And I'm gonna ask you to deeply inhale the medication for 5 to 10 minutes. And after I come back, I would ask you to rinse your mouth thoroughly so the medication does not cause any mouth problems. And we are done with the nebulizer after that. Okay, the next I'm gonna do the rectal suppository. I wanna make sure the rectum is clean and there is no stool. I'm gonna make sure that I do my 3-MAR check, which is while retrieving the medication from the pyxis, while preparing the medication before I give it to the patient. So I want to make sure I perform the hand hygiene and put on my gloves. I do have my lubricant jelly with me, and I do have the suppository. So I'm gonna ask the patient to lay down in Sims position, and I'm gonna explain explain the procedure, that I'm gonna expose their rectum, separate their rectum to expose the anus, and then I'm gonna insert the suppository with the index finger, making sure the suppository goes in and past the internal sphincter about 1 inch, and then I'm gonna ask the patient to be in Sims position for 10 to 15 minutes, and I'm all done with the procedure. And then I'm gonna document all the medication administration that I did for that day. Thank you.